blood clots on one side by just looking at legs and asymmetry as I'm walking around the wall. But in terms of dehydration, what's a really good way of doing that? You ever heard of something called tenting? What you do is you actually have somebody take your hand, this is the best place to do it, and you pinch it. And if it bounces back quickly, they're not dehydrated. If it stays up there and looks like a tent, an army tent or a camping tent, that's called tenting. And if it slowly goes down, you have to be about 10% down in terms of hydration before you see that. Something very simple, but it can make a difference. I had my aunt who had recurrent colon cancer. And she kept calling her doctors, and it was in the summer in northern Wisconsin. She kept talking about how dehydrated. Oh no, you don't need diabetes. It'll be okay. Just try and drink. The reality is, she finally went the next time, and she said, "Look, I'm tenting. You have to give it to me. That's at least 10% of my hydration." Guess who got an IV that day? So again, it helps your patients. They can check it at home. You can check it when you see your patients. Okay, sneaky physical exam. Want to bring somebody up? Okay, Harry's my boss. She said we can bring somebody in. Who wants to be a volunteer to show the sneaky physical exam? Lights up. Come on, at least one. Okay, two of you. Oh, you can both come. So what's interesting is I'm going to have you watch as they walk down the ramp. I think my voice is big enough without the microphone, or do you want me to bring the microphone?
No.
Okay, they said no. You decided you're only going to send down one, huh? Okay, now, she's walking down here. What do you notice about her walk? And what's your name? Katya. Katya. What did you notice about Katya's walk? She had some energy. She was smiling. Okay? Probably was a little embarrassed, but that's a whole other thing. But what if I want you to walk like that 85-year-old Korean gentleman that I talked about before, and you're walking, you can walk up the thing, because walking uphill is actually harder. She's going to be stooped. You're probably going to check on, now she's going to the side. That tells you a lot about what her physical functioning is, and she's just walking from the clinic room to the scale. Okay, she's good at this. Now, other than that, we've seen how she walks, how slow she is, how she's doing this. My guess is she's probably not got that big smile. She probably is looking a little depressed, because depression can go with malnutrition. She's probably, now she's just an ordinary 85-year-old guy who has been doing this for years, not so much. But if it's somebody who's just, because of their cancer, is doing this, they're really feeling bad and self-conscious because they're having to do this. So that, just by that alone, you can tell something about that patient. Come on down here for a second. Okay, now, you're doing research. Does everybody know you? Can you introduce yourself? Everybody knows Teresa. Okay. You're doing research in an area. What's an area that I'm going to show them right now? You come into my office. She's got a good hand grip strength. She's doing research with hand grip strength. But I'm just a dietitian or a nutritionist. I'm not doing research. This is the poor woman's or poor man's hand grip strength, hand grip dynamometer. I can tell a lot about her muscle mass and her strength by how she does that. Because she doesn't have just one part of her body that has good function and good tone. It's very interesting. Remember I talked about Gigi Boyendetsky. Gigi Boyendetsky did some very interesting work with stimulation of muscle. And they actually found if you take, and I find this is the best way, you take your index finger and your thumb, and you can actually use your third finger if you want to. But I want you to take and do that. Come on, patient, you have to do it too. And I want you to feel this, and feel this muscle here. If you do it right, you can feel really good tone. Okay, it feels kind of like a balloon that's has a lot of air in it. Now, if I've lost a tremendous amount of muscle mass, and I can't do it, my tone may be different. But in addition, I may just be feeling bone if I've lost a lot of muscle. So this is a really good way of looking at this muscle mass, and again, G2-Poindexky's really showed that if you stimulated that stimulation and how the muscle reacted was representative of the whole rest of the muscle mass of the body. What would you like to say? Because this is one of your areas. You probably know hands much better than I. There are some other ways of doing it, but is there anything you'd like to add?
Very important search for this variable, the hand is variable, and this and everyone likes to show their hands. It's very important. Oh, thank you. The physical.
Is it on?
Yes. No.
No.
Now.
Yes. Thank you, Faith. The physical health exam is a very important area of work. You should never forget.
Portuguese? I don't need to know this.
Yes. O exame físico é extremamente importante e é sempre esquecido pela maior parte das pessoas no dia a dia. Com o exame físico nós conseguimos ver e adivinhar algo que muito mais dificilmente conseguimos medir. Era isto que a Tracy queria transmitir. Com o exame físico nós conseguimos ver o adutor polícis, conseguimos ver o adutor da mão, conseguimos sentir a sua força, conseguimos sentir o seu volume, conseguimos nas têmporas de mão abrir e fechar o maxilar, nós conseguimos sentir o músculo mexer, se ele não mexe nós conseguimos ver, and it's very important first try to see on seeing the patient. É importantíssima a primeira abordagem. Thank you.